Carson City to find out how we've done so well with the issue around our people who are behaviorally health challenged and their interaction with law enforcement. It ends up for their good. So I think you'll find tonight very interesting. And moving forward, I would like to introduce myself. I'm Kathy Bartos. Then move on to housekeeping items. There are restrooms up, above, and behind this area over here, so you go up and to your left. We don't take breaks here. We just go right through till 7:30, and then at 7:30 we start questions. So kind of monitor yourselves accordingly. We have an exit here, and the exit is where you also came out of. So those areas would be where to go if you have some major concerns about safety. And we do written questions here. We find that we can get through more answers to questions if we have you write them down on an index card, and then there's Jay right there. We have Judy over there, rating index cards and little boxes, and they will hand out an index card and a golf pencil to you. Write down your question, they'll collect it, they'll take it over here to make sure it hasn't already been covered in one of the presentations or by another question person. So that's how we're going to do that, and we hope that you take advantage of that so you can expand your experience here. Let's see here. I'd like to thank Jeff Fast, who is up there, and he's the Brewery Arts Council tech guy, and I cannot tell you how easy our lives are here at this forum, knowing that he is there for us the entire time. So it's a huge relief here for Jeff. And new to us, he just all of a sudden appeared one day like a little angel and poof, and there he was, Ken Griselle, and he videotaped for us at the last forum, and it was unbelievably well done. It was just amazing. This is a hard room to do video in. And so we're going to be making his videos available by going, I think, to Sierra Nevada Forums and then linking it somehow, and that's the expanse of my knowledge with that. So it's up to you. So, great. So thanks very much to Ken. Yeah, so tonight we have 4 really wonderful speakers for you and an equally excellent moderator. So I would like to introduce Judge Tom Armstrong to you. And you all got a synopsis, did you not? A 2-page synopsis, did you all read it? So I don't need to read it for you. Okay, because that would add another 2 hours onto this whole forum. But Judge Armstrong, he was appointed to the Carson City Board of Supervisors by the Carson City Board of Supervisors April 2011 to take the place of longtime server of our community, Roby Willis, in Department 1 of the Carson City Justice and Municipal Court. And we've hung on to him ever since. You're stuck. You don't even get people running against you. So you're really stuck. So he also served as Judge Pro Tem for Carson City in 2009. He handled both criminal and civil cases. If you'll note in your little description of him, he also practiced law as a sole practitioner under Thomas R. Armstrong, LTD. And he was also appointed to the court as a conflict counsel for the Public Defender's Office. As a conflict counselor, I think that's where he got some experience working with people who are indigent, and so that was excellent. From 2001 to 2007, Judge Armstrong served as a senior deputy district attorney in the Carson City District Attorney's Office. So clearly you are not a one-trick pony, Tom. We are very fortunate to have you, and we intend to use some of your knowledge up here. He is a long-time resident of Nevada, 38 years, and he grew up in Carlin. Carlin. How many people have been in Carlin? How many people count driving past 3 minutes being in Carlin? Okay, that's not fair. You can't count that. And do you know that Carlin is celebrating 150 years this past year? 150 years. And they have less than 10,000 people, except that, well, they have less than 3,000 people. 2,800 people.
Yeah, that sounds about right.
Yeah. And when did you move out of there? How long did you stay there?
I went to UNR in '91, and I was kind of had family there, and then I moved to Carson. So once I left high school, I came back occasionally, but I've been gone since '91.
Okay. Well, it's a very interesting little community. 150 years ago, do you know that the Donner Party went through Carlin?
We have a lot to talk about.
Yeah.
Not Carlin.
I was going to introduce her down to the cutter off so she can save time. Actually, no, that is Sarah Adler over there. Sarah is the president of the National Alliance on Mental Illness, and she has been a real advocate for us with our population in need of behavioral health services. So hats off to Sarah. We're glad you're here because you might even be able to answer questions they can't tonight. So all that being said and done, it's all yours.
Thank you. Nice introduction. My name is Tom Armstrong. As you know, I am here to moderate. We put this together, and I thought to myself, how can I get out of actually presenting anything substantive? I'll tell you what I'll do. I'll help MC this, let people know what they're talking about, present. So that's my job, is to defer to people who really know a lot about what's going on as far as the topic here. I'm going to say that, it's an important topic to me as a judge. It's something we see every day, but as a defense attorney, as a prosecutor, it's very important. The intersection of mental illness, mental health, and criminal justice is very important. It's a huge component of the criminal justice system. I will say, when I started here as a baby prosecutor there in 2001, there really wasn't much. Somebody get arrested, they go to jail, they spend some time in jail, they get out, we see them again, and there didn't seem to be anything but a revolving door with no progress, no end game, right? Just a revolving door. A lot has changed since 2001, and in large part, law enforcement, Sheriff Furlong's here. They have tried new things. They've expanded their view of mental illness and criminal justice system. Judge Tatro is a pioneer, a true pioneer, especially, of course, starting one of the earliest mental health courts anywhere to address the criminal justice. Dr. Joe has been here as a jail psychologist and been a huge facilitator in showing the courts and the criminal justice system what they're dealing with, and how we can different approaches to helping the people who need help in the community. And then with state and local government represented here by Jessica Flood, who I've had multiple conversations with regarding programs we're trying to implement, who brings in the social services piece and the state government piece, where everyone can work together, and you'll become more clear what I'm talking about once everyone starts talking. But to work together to try to address a significant issue, a significant problem that wasn't even as recently as 17 years ago being addressed efficiently at all. It's probably as inefficiently being addressed as it possibly could be. So I'm just going to say, you can hear more from them individually. Let's give a quick round of applause to our presenters, and then we'll start with So Sheriff Kenny Furlong is here. He's born and raised in Carson City. He's been our sheriff since 2003. He was just reelected and sworn in yesterday to his 5th term. He enlisted in the Air Force in 78. During his career, he earned his Associate in Political Science, or Police Science, Criminal Justice, and a bachelor's degree in Criminal Justice Administration. He retired from the U.S. Air Force in 98, continued to work in law enforcement, and accomplished numerous major detachments, major crimes, investigator assignments. We know Kenny is a guy in uniform at every event. We know Kenny is a guy who's happy to address anybody who's willing to have him. He's also the guy that I'm proud to have been my sheriff for as long as he has, and to have really, as far as what we're talking about here, mental health, really done a lot to facilitate different approaches, criminal justice responses to those with mental health issues in our community. So we all know who Sheriff Furlong is. He's Boys and Girls Club, Circles, CASI, Community Counseling Center. He does it all. He's everywhere. We know who he is. Let's give it up for Sheriff Kenny Furlong.
Way too kind. See, the more that you talk, the more the audience knows that you don't know as much as you're talking about. So I'm going to try and have some fun here tonight, even though it is a very, very serious topic here. Right from the onset, I would like to give credit to a couple of mentors when it comes to mental health and how I got engaged in these issues. number one, Doc Joe, he's down here, he's going to speak to you all this evening. But certainly Doc Joe is one of those people, when he speaks, all people listen. And I mean that everywhere I go throughout the state. And Doc Joe would, I'm sure, join with me in one of the most pivotal meetings that I've ever had at the Sheriff's Office in the last 16 years, and that was with Dr. Richard Whitley from the state, inspiring us to do things that we never thought about doing before. So with that, years and years, don't even try and read that, because it's not intended to be read. Years and years ago, I read an article, and I think it was out of the New York Times, and it was talking about a reporter who created art out of numbers. And I think that there was value in that moment as I read it, because it does come back to the numbers. What is your problem? What are your challenges? Not that you make up in the hallway. You walk down the hallway and your fellow employee says, I'm overworked and underpaid. Well, shit, you haven't done nothing, and the numbers prove it. But there is an art in here, because as I fill the screen up, and Kathy asked me to, as I fill the screen up with some of the data that we collect, it creates a picture. It creates a picture of what's going on in our community that we can actually put our fingers on and help us guide our responses. And that became truly a task, and it's been ongoing. To give you a little bit of insight, the major goals that I've tried to push out there is, number one, jails and emergency rooms are not the place to house mental health folks. Period. My sister fell down, she'll probably yell at me for telling you the story. She fell down last week, broke her arm, cracked her head open, and they took her up to the ER, they stitched her up, put her on the sling. That's what the ERs do, right? Jails and emergency rooms do not facilitate mental health treatment. And we have long held that. So back in, to give you a little bit of background for all of this stuff that's up here on the screen, this beautiful masterpiece of art, and it truly is. I'm absolutely committed to it. I'm going to call it back in about 2008. We saw many events going on all the way around the country where mental health people were, I'll use the word, abused by law enforcement because we didn't know any better. That's why. They were abused by law enforcement because we didn't know any better. So we instituted a program here in Carson City called Crisis Intervention Training. And that was to retrain officers to realize that this uniform actually has a presence or a challenge to escalate an issue far before I open my mouth. We had to retrain officers on how to better recognize crisis and how to better respond to that. And we did very well, and while we continue to do that, other agencies throughout the state, or certainly throughout Northern Nevada, are receiving the trainings that Sergeant Craig Lowe out of our office and Becca Bach have been providing. So crisis intervention training became our mainstay. Then we had the unfortunate incident here in Carson City, the IHOP mass shooting. And I will tell everybody in this room that the reality at the end of the story was the IHOP was a magnification of a mental health crisis that exploded at a moment. It absolutely exploded. Had the family, in hindsight, had the family have known what resources were available, had those resources been coordinated, had we joined together with them, that incident may never have occurred. And that's an important feature to remember. Because very often, the families are the first ones to recognize that there's a mental health challenge, but they don't know where to go and how to deal with it. So round about that 2010, 2011 timeframe, we started expanding our responses. And as always, Doc Joe was one of the first guys to come to my rescue and presented better ideas and better approaches. Forensic teams inside the jail that are there to make those connections and move those that are lost or in crisis through the system. It became very, very important. But what came out of that, and it has just evolved in the last couple of years, is we need to keep families together in their own homes. Remember, our goal is to keep them, these folks that are in crisis away from the jails and away from the emergency rooms, and get them services that are most beneficial to their lives and their families and their homes. And so our mobile outreach started emerging. And now we have a mobile outreach officer on the road, Ms. Becca Bach, and thanks to our board of supervisors, we have one out there today. I see one because really the bright lights. Ms. Lori Bagwell is here with us today. We've now this year just instituted a behavioral health peace officer on board. Because the philosophy is to go out and help folks before that crisis becomes so violent that jails and emergency rooms are the only answer. That's what we intend on achieving. I say this, trying to do right here. I said it's distracted when the speaker always turns his head. Do not look at my bald spot on the back of the head. Do not record that.
Moving to the front.
A couple of years ago, we brought some mental health providers in, Dr. Joe inclusive, and we started looking at that previous slide. What constitutes a mental health crisis in Carson City? And what we ended up doing was creating a three-tier system. We now recognize drugs, alcohol, aging, all of the different levels of crisis that we see on a daily basis. And I see far more than most of the folks in this community would ever want to know about. Those people who are sitting alone at night, they're senior in their years, and they're so lonely that they just constantly dial 911 because that's the only company that they can find. So we deal with all sorts of mental health levels. But the crisis was erupting. You see that back in 2003, 2.1% of the total volume, and we run about 40,000 calls for service a year. 2.1% back in 2003. We're now up to about 5%, over 5%. Over 5% of what we do has some mental health nexus to it. And that's a challenge for a community that is very, very caring. I like telling the story. I love David Letterman. We do a top 10 calls for service type every year, have for 16 years. And the number one type of call for service in this community actually happens to be, would you check on somebody for me? I'm concerned about someone's welfare. They're not acting right. I haven't seen them. That's the quality of a good community, when we look out after one another to the point where an officer will go out. And that CIT training allows him to recognize those signs and symptoms of that mental health crisis, if in fact that is the call or the core of the call. And when those techniques that we've trained the officers and the resources that we've provided them aren't quite well enough on board, we have that transition that we can make over to a mobile outreach team, Ms. Becca Bach and Deputy Don Gibson, who is assigned our behavioral health. Those folks can respond immediately to those people that are in crisis and create a connection into our services and resources in the community that can better help to keep the person at home and benefit the community as a whole. I like to say this, I don't like to say it, I say it all the time, and every time I say it I apologize to Doc Joe, but our forensic assessment team in the jail, to me, is the mark of our failure. Those people whose services cannot, or needs cannot be met by the officer on the scene, or those people whose needs cannot be met by our mobile outreach, and that the crisis is so severe and left so unattended for so long, don't look at your watch. That they end up in a violent outburst where we have no other alternatives. That's a real challenge in this community because it's still taking place today. Even though we have put on so many of our resources into the problem and the challenges. We talk about the individuals that are straining the community, straining the 911 system, straining the resources, constant medical attention to fire and police services. Very often, repeatedly, over and over and over again, sometimes in the same evening, officers and paramedics and resources are going back and forth to try and calm a circumstance that is so far out of control that it's going to take an intensive amount of work through the best professionals to overcome the problem. And so with the assistance of the court system, we can better start targeting and allowing folks into resources, guided resources, through these crisis interventions, mobile outreach, forensic assessments, mental health courts, specialty courts, all of these things that recognize that it's not just about mental health. It's about in many cases, addictive behaviors, such as drugs. It's about crises such as aging and assisting and working with our youth in this community. It's so very, very frustrating that as a parent, I ask for help and the response is, well, there isn't any here. And I've had that happen to me. I've had that happen. We need to provide those resources for our kids and our adults in this community, and certainly for those who are aging, so that they don't become super utilizers. Super utilizers are the ones that are eating up most of those resources in town. We've gone to the emergency room for a certain thing and ended up having to wait for hours and hours and hours because those super utilizers are taking up and consuming all of those resources up front. And it becomes a real burden on the rest of the community and society. And so we certainly have made great strides in the progresses. Bottom line is this: we have far more to go. While we enjoy that first artistic spreadsheet of the numbers, we are just at the beginning stages of wrapping our arms around the problem, if you will, or the challenge. I walked into the jail one day, and this is a true story. I told Doc Joe about it today. He knows the gentleman very well, and we have a high security watch cell right there at the booking counter. It's all glass. You can see the person inside it all 24 hours a day. And as I walked through the door, a young boy was waving his hands and he said, "Hey, Mr. Sheriff, hi." And I was like, oh my God, how did this man get into this jail? He doesn't belong here. Whereas in an adult body, he had the mentality of a 7-year-old. And yet his behaviors were so out of control that he ended up in incarceration. Today, I don't believe that would happen, or at least today, immediate resources would be fielded to that type of a person so that we can better respond, so that we can keep folks out of our jails, except for those who truly need to be. And yes, there are those that truly need to be. Their disorders are so violent or so criminal that we have no other alternatives. In fact, early data that we are collecting is showing that in the past year, we are beginning to see signs of successes. We certainly have many stories of successes, but we still have a very challenging population inside of our jail here in Carson City that needs those resources and is using them. And I certainly, we talk about the 1 in 5 in the jail that are severe cases. I certainly wouldn't want to, in this type of a forum, describe to you how horrific that can be inside of a jail, and the behaviors and the threats to one another, and how these folks cope and survive. Individuals with chronic disorders, they end up spinning through the system over and over and over again. And one of the challenges that I have, and as a matter of fact, we were just speaking about this morning, is to really come down to a system where we can quantify. Back to that original. Quantify the results of what we are doing. Use those numbers to create that artistic image of what we are in Carson, who we are, where we were, and where we're going. And I believe that we're going to continue to make those progresses, and we're going to make those successes. Because the one thing that has happened in Carson City in the last, and I'm going to say it just as a ballpark, in the last 10 years, is the silos have gone away. And people work seamlessly together. And instead of one conflicting, patients are being better treated, people in crisis are being better understood, and the resources are being applied to ensure that each and every one of them has the right and the privilege of living a perfectly normal lifestyle. Perfectly normal. With occupations, with jobs, with families, hopefully with children. That spin cycle has been a challenge for us. And I do thank Doc Joe, I do thank Mr. Whitley for inspiring the Sheriff's Office to begin on that process of creating a better response for Carson City. So that incidents such as the IHOP, truly absolutely a preventable incident, would never ever again occur in this community. And we are doing well. But some of the challenges are coming because while we sit on the border of are we rural, are we metropolitan, what is it that Carson City is? Carson City is a center of resources, and many of those resources are in need by our friends in the outer counties. The stresses that in order to get their patients access to resources very often create a bigger burden on Carson. And I don't say that as a criticism to them. I understand. I understand the fight that many of these agencies have. If you're a rural department in the middle of Nevada, how do you devote those resources to move a patient all the way across the state to a bed, as we talked about before, to a bed in a mental health service provider that doesn't have bed space readily available? And somebody ends up waiting in the jail or in the emergency room in the hospital for an extended period of time or is not receiving any treatment. We can do better. We can do better. And I think that Carson City, thanks to these absolute excellent professionals right here, I am not the cornerstone here. These folks right here, they lead me down a path that has been so progressive and so beneficial to each and every member in this community that a unique challenge has crept up on us, and I will close it with this. A unique challenge has crept up on us. Our officers are very well trained. Our mental health resources are out there, they're mobile, and they know many of the patients and how to deal with them and how to treat them. What crept up on us this year was some people in the public do not see that. They see that law enforcement is failing to act in many cases. It's not law enforcement failing to act. It's a law enforcement approach that is much better than ever in the past. Rather than handcuffing or getting into a scuffle or getting into a fight or someone getting horribly injured, we can manage the problem. We can manage the problem at a much better level than ever before. And so I'm going to take the privilege. I don't know if I get the privilege, Judge, but and you'll probably do better. But I do want to introduce Dr. McEllistrem. I didn't hire him; somebody else did. But he's been with me for the 16 years that I've been the sheriff. And I will tell you, there is no better mentor for a sheriff to have. For someone to understand the challenges that mental health have on the criminal justice system, the opportunities that the system has to create a better lifestyle, and a caring person. I like to say that Doc Joe is the only one in the sheriff's office that can overrule any statement or policy that I have. If a person needs a better alignment from the detention center or needs to be moved to a different type of program, I 100% of the time would say yes to Doc Joe, because this is truly the guru of services that anybody can provide. And I think that most counties would give anything to have a gentleman like him. So unless you want to do more, I certainly.
I gotta earn my money.
Yeah, Doc Joe, Judge Taker, Judge Armstrong, and certainly Jessica, truly leaders in this community that have benefited everybody. So thank you very much.
We got most of the introduction done for our next speaker. So the next speaker today is Dr. Joseph McEllistrem, otherwise known to all of us as Doc Joe. He's a forensic psychologist in private practice in Carson City. He earned his doctorate in San Diego as a fellow of the Carl Menninger School of Psychiatry. He is an evaluator and expert witness in criminal and civil cases. I've actually hired him when I was in private practice, both locally and nationally. In 1996, he collaborated with Dr. Reed Malloy in assisting the prosecution of Timothy McVeigh and Terry Nichols. That's not something that I did not know that. Following the bombing of the Alfred P. Murrah Federal Building. 12 years ago, he was hired as a director of forensic health services in Carson City Jail, and 4 years later, hired in the same role with Douglas County Sheriff's Department. In 2005, he worked alongside Judge Tatro, the Public Defender's Office, the DA's office, in establishing the first Carson City Mental Health Court, where he continues to be a member of the team as a consultant. In 2012, Dr. Joe developed a forensic assessment triage team, services triage team, otherwise known as FAST, which I'm hoping he's going to talk about today. A psychiatric intervention program developed to support and assist law enforcement in responding to calls for persons with mental illnesses in the hopes to prevent incarceration and to aid the mentally ill if incarceration cannot be averted. His expertise is largely in the areas of psychopathy, sexual deviance, and violence risk. So, Dr. Joe has been, only been 12 years. Is that right, Dr. Joe? But he's very important to all of us we're talking about. These programs, FAST, most, these things, he's been on the ground floor, if not the instigator for all of these things that we're going to talk about today. So let's hear from Dr. Joe.
Welcome. So what I'm going to talk a little bit about today is the Forensic Services Triage Team that we started and kind of gave birth to in about 2012, and then we launched it in February of 2013. So when I was trying to think about how am I going to introduce this, I thought maybe to make it a little bit more interesting, I talk about a case. So is that readable? Because I don't want to read these to you. So this is a gal, Jane Doe, that I had first contact with in about 2002. No, correct. Let me check that date. It was 2002 or 2008. Yeah, it was 2002. So I started with the department in 2001, and a year later I was introduced to Jane Doe. And so what I decided to do, because she was arrested 58 times between 2002 and 2015, but contacts with law enforcement number in the hundreds. In other words, a call for service that didn't land her in the jail. They tried to deal with it on scene. So what I wanted to do is just walk. So these are quotes from probable cause statements written by the deputy that had an encounter with her. So you can see on the first one, she's throwing food and intoxicated at a restaurant. And it looks like she chucked a hamburger patty at a patron before surrendering to law enforcement. She had a blood alcohol level of 0.22. So I think the cutoff for driving is 08. So, we're getting close to 3 times the legal level. And these measurements are often done well after someone's detained. So there's a chance for those levels to actually drop in time. So this is one of the encounters with her that ends up being kind of a repeat story for this woman. Now she's passed out between parked cars in the parking lot of a Dells. So she has taste, right? She knew exactly where to go. I mean, but she was unable to care for herself because she was so intoxicated, right? Early in the next year, this owner of a laundromat told me that she had defecated inside the dryer. What's that? So, and this is someone that she ends up having a lot of contact with over time. And so my point is, these instances, while we kind of refer to them as nuisance crimes, it's probably not a nuisance for the owner of the laundromat or the person that got hit in the head with the hamburger patty, but they're not the crimes of the century, right? But they have to be dealt with. And so now you're going to start to see over time, she starts to, really diminish in her ability to care for herself and to function in society. And you can see she had been trespassed 3 times already, right? So you see this recurrent kind of theme. So it's not a one instance kind of a case. And this is just a representation of a great number of people we're dealing with in the community that have mental health issues, addiction issues, homelessness issues, and functionality issues, really. So this is the case. So now in 2011, she is drinking in a public park. And she's highly intoxicated, and it says here that she was found in much the same way as the officer found her the first time he met with her. So again, right, repeat call-outs. And she was filthy, urine stains, she was defecating herself, right? So this is someone that's not able to care for herself. And at this point, she's homeless. She had been staying in a residence off College Parkway for some time, but was kicked out of that apartment for her behavior. It's another contact with her event. Again, she's back at the laundromat, and the woman mentioned she's been dealing with this problem for years now. She's an ongoing problem, and she's a 0.24, so now she's over the, 3 times the legal limit. And, this is occurring in front of the customers and the children of the customers that are in the agency. You can see in this case in 2012, she's encountered by law enforcement. She's again intoxicated, and she had defecated on the sidewalk. And she had done this, urinated in front of Charm Nails Boutique in Tommy's Bar. So, she's moving about the community. She's engaging in a lot of similar behavior, and you see the trend. Intoxicated, often homeless. In 2013, they had an encounter with her where she was unconscious on the sidewalk, and when awoken, she asked how she could help the deputy. So she was trying to be helpful. And this was the 4th time that very day that they were called out for her. Right? So again, it's not one person or one instance. This is 4 times. This deputy runs the beat. Right? He's got calls for service in a geographic area that he has to attend to, but 4 times that day alone. So you say, why do people get arrested for this? This is why. You can't keep going now, though. So on the 4th time, she was detained. And she's a 0.255, right? So you're starting to see these levels creep up a bit, right? In terms of her alcohol level. The next case I pulled out from 2014, again, highly intoxicated. She's unable to get to her feet now. So she's really starting to physically manifest problems through the years of untreated mental health and addiction. And the paramedics were called now. So it's not just law enforcement, right? There's other agencies involved. So now paramedics are tied up with a call like this. And it was an old foot injury she was using to try to stay, I think, in this building and not leave. And you can see there it says, this is an old injury. We've seen this numerous times at the hospital, right? So that tells you she's been to the ER over and over again. One more agency that she's receiving services from. 2014 again, a female lying on the ground. Once on scene, I immediately identified a known subject to me, right? So law enforcement recognizes her on site. There's that many calls out for this gal. She was highly intoxicated and unable to get to her feet again. So she's really physically declining now. Every time she comes into jail, we're starting to see that. The next case, she's sleeping out by the dumpsters again, is the way it's written, right? So they've been finding her here before. She was talking to herself now. So now she was starting to have problems with auditory hallucinations, and she's waving her arms about, right? So you're really starting to see further and further decline. The next case, 15, they had to go to the emergency room, right? So now she's back at the emergency room. She's found there with a tennis shoe on one foot and a mismatched boot on the other. Just in terribly stained and torn pants, and she had no clothes. In 2015, she was again asleep on the sidewalk. She was passed out. 0.30. So what, 3.5 times legal limit? And on that next occasion, she's yelling at patrons, and one claimed to be struck by a chicken nugget. She's in our jail, 58 times. She had a wicked sense of humor, actually. We sort of enjoyed her for all of this. Okay, this is the last call out. So she's covered in feces and had a strong odor of urine, alcohol, and fecal matter. The owner stated she came into the laundromat. Say she does like that laundromat. And discovered the woman sleeping, feces all over the bathroom, feces on the waiting room chairs. She had numerous open infections in both her lower extremities. That was July 2015, July 11th. That's the last time we encountered her. That was it. So this is why we got involved, because we knew something had to change, right? The law enforcement intervention alone wasn't enough in this case. And so what we knew is we had to give deputies tools. They had to know how they could do something differently instead of repeated call-outs all the time. And so Sheriff Furlong instituted this crisis intervention training where each officer gets 40 hours a year in a week-long training specific to mental health and addiction and the encounters between mental health subjects and police officers. So we can really change our approach in encountering them. Then, with that kind of training, that allowed us to develop the MOST team, right? So the Mobile Outreach Safety Team. So now we have a behaviorally trained officers. Many of them, I think every one of the departments trained. The only ones that aren't trained are ones that have been hired recently that haven't come up on the date. So, unlike most departments, every single officer is trained in CIT. But we selected one that was particularly talented. And he's the behavioral health peace officer, Deputy Don Gibson. And he's paired up now with a behavioral health expert, Becca Bach. So now they have a dedicated full-time officer that gets all the calls for service that come through dispatch. They have some indications for mental health, and they're the two that respond. Because they're not looking for a law enforcement intervention, they're looking for a mental health intervention. So now they can divert people away from the jails. They can get them to Mallory Center. They can spend time with this individual. The average length of contact with the subject in the community who has a mental health issue and needs to be arrested is 20, 25 minutes, something along those lines, right? You roll up, you figure out the problem, you arrest them, you take them to jail. If you're going to intervene now and try to divert them, on average, 120 minutes, 2 hours. But it's worth it, because those Smiths spend weeks in the jail, months in the jail, potentially, right? But who has that time on a beat when you have that much geography to cover? So now they have the skills, and now they have the time, and now they have the training, and now they have the support of a clinical provider that rides with them for every call. And they don't just in crisis. Once they make contact, they follow up time and time and time again to maintain the person's gains so that they're not called out for a crisis in the future. And so that training has helped us come up with some very unique ways to deal with the individuals who are really struggling in the community without just coming to jail. Jails and emergency rooms are by far the most expensive ways to treat people with mental health issues and addiction. If they're unable to handle it at that level, and they are arrested, they cross the line they cannot overlook, or they're unwilling to engage a treatment strategy with the most officers on scene, then they might have to come to jail. And that's where the FAST team comes in, the Forensic Assessment Services Triage Team. What we were getting is kind of a discoordinated approach to mental health early on. We would identify a problem, we had a limited amount of time with them. Much of our time in the jail was spent getting them detoxed, getting medically addressed, and figuring out what we had to deal with their mental health issues before they were released. Because the average length of stay isn't that long. For the mental health, it goes up somewhat exponentially, but for the most part, we have a limited amount of time. So we were making referrals to the community so that they could continue what we started. What we found is they weren't continuing. The average follow-up was less than 3%. So we had this revolving door. They come back in, they're intoxicated, they're off their medications, they weren't addressing their needs. We'd start all over again. It becomes very expensive and it becomes dangerous, right? Because they're leaving and they're going off their medications cold turkey, or they're engaging substances again while they have these medications in their system. So this was not a workable solution. And so we would rely on this idea of let's get a system in place where we can not only address what is going on with them in the moment, but let's begin treatment immediately. And let's use the agencies in the community that are going to provide the service. So what we ended up doing is, it was easy to get the referrals, right? Courts knew who needed to be seen, the jailers knew who needed to be seen, I knew who needed to be seen. So we had to come up with a system. So what we did is we said, all these islands and all these silos of care that exist in the community, why don't we invite them into the jail to provide service? So we knew we needed someone to represent mental health. So we went to Carson Mental Health and said, would you volunteer a staff member every week to come in and work with developing treatment plans for our clients? Then we went to Community Counseling Center and got hold of Mary Bryan and said, would you volunteer someone to come in to represent the addiction piece? And then we realized that the overall functionality of the individual and the overall family needed to be addressed. So we went and we approached Swanwood Family Resource Center, and they volunteered somebody to come in. And then we realized we needed one more participant, someone that could deal with the crises in the moment, an immediate response, and that was Health and Human Services. We need a bus pass, we need 2 nights lodging for this person, when they get released from custody, until we deal with their housing, those immediate needs. So those are the 4 approaches: mental health, addiction, the family, and crisis. So they come in every single week as a team. They meet with every client that requests services or is referred by the courts or is referred by a jailer. And before they leave the room, they have a treatment plan in place. We can't institute all pieces of it, but it's done. So that might mean then we're giving them a long-term inpatient stay at Vitality Center in Alco, let's say. That might mean we get their medications restarted. That might mean we're going to maybe approach the mental health court for a possible admission or the drug court for a possible admission. So we're trying to handle these both individually, clinically, address their medical needs, get them involved in substance abuse and mental health counseling before they leave. But what we want really is a relationship to develop with the outside community providers, to encourage them to continue with them. So we said, don't send us a staff member or a supervisor. Send us the representative that this person's going to work with when they leave. So when they go to Ron Wood, they'll say, I'm here for Erica, I met her in the group. And that's who they work with. So I think what we've really tried to do, think about it. So this gal that was coming into custody so often, she had to be fed. She had to be medicated. She often had medical issues that had to be dealt with. She had to be assigned a defense attorney. The DA had to be involved in the case. A judge had to be involved in the case. And as she aged, dementia started coming on. We think it was probably alcohol-induced dementia. We weren't sure. So that meant every day she came in for chucking burger patties and chicken McNuggets might result in a placement at Lakes Crossing Center, which is a place to determine whether or not she's competent to even go forward in this case. And if not, they might provide treatment. And then she comes back. So you're adding weeks to her stay and volumes of resources and money. And then she gets released and they get called back. Right? So you can see there's a tremendous burden on the system for chicken McNuggets and not having a bathroom. So, what happened to her? In 2013, the Carson Tahoe Hospital, Dr. Meg Jack came to me and said, can you replicate fast in our emergency room? I said, no. Body parts and blood, that's really not an environment we can do this in. And she said, no, we need something because we have these super utilizers and they're getting worse and they return. And we're helpless. We just don't know what to do. And they're tying up bed space, they're tying up resources, and we don't know what to do. So we developed an overutilizers group in 2013, and we invited all the agencies in the community that might be involved in any particular case. 18 agencies showed up. That's how many agencies in this community have contact. Now, we don't have all contact with the same person. So when I go to these meetings, they'll break up a name I never heard of in the jail. But everyone in that room came because Carson Fire Department, Carson Mental Health, think of all the agencies, the homeless shelter, they were coming because they didn't know what to do either. So I brought up Jane Doe, and everyone rolled their eyes. They all knew her. And I really felt she needed a guardianship, and guardianship said, we've gone down that path. She just fought us every time. Fought. And frankly, we can't find anybody to do the full comprehensive evaluation for guardianship. There's no way to pay them. I said, I'll volunteer it. I'll do it if you take the case. I said, if you're going to do that, if you're going to volunteer your time And if you deem that she needs guardianship services, we'll task our attorney to take that to court to get her temporary guardianship. And then someone said, well, that's great, but then what? So Carson Tahoe Hospital said, you know what? If you do all of that, we will open a bed for her at senior pathways. And we will continue her medical care. We're going to address this issue of dementia. So she doesn't have to be treated in the jail anymore. She'll be on appropriate unit. And then someone else said, well, what long term, where's she going to go? Senior pathways can't keep her forever. So I don't know if it was Aging Services said, we'll find a nursing home. So this is a person that everyone said we can't do anything, but what they meant is they can't do anything alone. And so once people started to volunteer, knowing they were going to have the backup of fellow agencies, they were willing to jump in. 2 months after her admission to the nursing home, she asked for makeup and to get her hair done. So she is still there, been there since 2015, and after hundreds of contacts and 58 arrests, there's been 0 contacts, 0 call out for services, and 0 arrests since that last slide you saw in 2015. So it works. Thank you.
5 or 6 of those years. I prosecuted her before that. The day that Dr. Joe came to me and said, we have a plan for Jane Doe, and I, too, may have rolled my eye and said, I've heard this before, and I have not seen her since. And when I heard how well she was doing and how much things have changed for her, it was really, I couldn't believe it. I still have a hard time believing it. So anyway, we'll get a chance to talk more about that. But this was a person who defied every attempt that the courts made to try to do things better. First I let her out of jail, she didn't never show up, be arrested. Literally hours later, right? Coming right back in, saying, OR, I couldn't get her to take a plea. She insisted on pleading not guilty till the very last minute, and she'd always plead guilty at the end. Until the competency issues came up at the end, it was just somebody that was particularly challenging for the courts to deal with. And I think the courts, you only have to engage as much as you choose to, right? For the people in the community who are tasked with actually helping her, giving her services, it was a tremendous amount of work for this one particular person. So anyway, we'll get more into that, but I was pleased that the good doctors have used that case study as an example, because as soon as, obviously, her real name was Jane Doe, but as soon as I read the first blurb, I knew exactly who it was. So we are going to, I'm going to remind everybody, we have a question and answer session. I'm going to move along here. We're a little bit, we might be a little bit ahead of schedule. I think we're going to get a lot out of the questions. So, over here, if you have any, you're looking to screen them to make sure that, that they're appropriate for the forum, but fill them out, send them down the line. Let's get some good questions. I'll make things really enjoyable at the end. That'd be my favorite part. So I'm hoping you all decide to do that. So I am introducing the very next speaker. It is Senior Judge John Tatro, who up until noon yesterday was my co-judge in Department 2 in the Justice Court. And he has been a friend of mine. I grew up as an attorney in his courtroom, along with Judge Wiltz's courtroom. I learned an immense amount from practicing in front of him. I learned even more from him as my co-judge. He was the Justice of the Peace, Municipal Court Judge in Carson City, beginning in 1995. He was voted Judge of the Year in 2003. He was attained a level of distinguished jurist in judicial education in 2008. He was president of the Nevada Judges Association, Nevada Judges of Limited Jurisdiction, a member of the State Judicial Council, member of Judicial Code Commission, began the Mental Health Court, member of the Special Court Funding Committee, worked with Justice Court staff to implement a more effective case management system. So really, he's just my friend. So, here he is, well known, Judge Intercept.
I'm proud to call him.
20 minutes, sir.
20 minutes. Okay. Really quickly. Yeah, Jessica pointed out to me that when the sheriff was speaking, when the sheriff was speaking, his picture was up, and it was an old picture. I just want to point out that I had that one taken last week. In my office. I just took my glasses off. And Judge Armstrong, in the very beginning, when he was talking, it's been quite a while now, Sheriff talked for an hour, I think, but right before that, Judge Armstrong said some things, and he said he didn't want to be on the panel because he wanted people on the panel to be people that who know what they're talking about. But let me tell you something. Tom Armstrong, Judge Armstrong knows what he's talking about. He's one of the smartest guys I know. And he's one of the most dedicated, passionate people I know. As far as...
You only have 20 minutes.
As far as... You need to know this. You guys voted for him. I did too. I can say that now because I'm not an active judge right now, and I won't be a senior judge for another day. So he has, taken this specialty court thing and taken his job as a judge so serious and knows more about addiction and specialty courts and how to handle it and all those issues than anyone I've ever seen in such a, short period of time. I know he's been a judge for 8 years now. 7. Seems like 8 to me. But I just had to say that. And I don't know, he called me a true pioneer, and I think that means old. But, and then I have to point out to the sheriff, and I have a couple of, I don't get to do this much anymore since I'm retired. I lay around and have nothing to do. This is my second day. It's true. The sheriff, it's so understated, all that he's done in the way of mental health. I'm not kidding. And I thought he hired Dr. Joe. I was ready to give him that bit, but I can't. It was, Rod Bannister did that just before the sheriff came in, but the sheriff kept him. So that was a great thing. I hate to say good things about Dr. Joe because he seemed very modest up here, but he's not. But the sheriff was fast, and the crisis intervention training, and everything that he's brought in is so progressive. I mean, I go to court, I know Judge Armstrong and I used to go, I'm retired now, went to conferences and talked to other judges, including in Las Vegas and Washoe County. They don't have the hands-on, the team that we have in Carson City, and we're so fortunate. So those are the nice things I'm going to say about them. So what happened I'm here to talk about specialty courts, but specifically mental health court, because that's pretty much what I've done. In 2004, Ann Langer was the chief deputy district attorney, and Diane Crow was the state public defender. And these are two different personalities that clash, we'll say, once in a while. And to be in the same room with them sometime was less than comfortable. Not for them, they loved it, but the rest of us, And they came to me together into my office one day, and I was afraid. And then I felt I was safe. So they approached me about starting mental health court, and I was kind of taken aback. And with them, though, I don't know if in the first meeting, but maybe the second meeting was Dr. Joe, and we've all keep hearing about Becca Bach, who's with Carson Mental Health. She was an integral part of that too. So Becca Bach, I love her name, Becca Bach. We can say that a lot, Becca Bach. She was always there. She's been there from the beginning about creating these great resources and being a part of these great resources, as has Dr. Joe. So anyway, they came to me, and and they wanted to start mental health court. So they convinced me, and because I knew that we had a problem, and you guys have all listened to the issues that have been coming before the courts and our community for all these years. And like Kenny said, the sheriff said, it wasn't that we didn't care or like the deputies out on the scene didn't care or they were mean. They just didn't know. They didn't know any better. They were trained to resort to taking them down right away. And I was trained to send them to jail right away. And that's the way things were. But after a while, being on the bench, you start seeing that, this isn't working too well. I keep seeing this guy coming back and back and back. And you realize that we have to do something. So we did. And, when I say we just started mental health court, it didn't just happen. It took about 1.5 years to get it going. We had to, first of all, we had to get people to buy in. We had to get other people to buy in, to bring other, like, for instance, Carson Mental Health and the Community Counseling Center and the Sheriff's Department and Department of Alternative Sentencing and the District Court. The District Court had to buy in. Without District Court, we couldn't have done it because, that's a whole other story. But District Court, back then, I think it was Judge Griffin, thought it would be the late Judge Griffin thought it would be a good thing. So he let it happen, and he had to let it happen. So we went to the Judicial College, and we got the team pretty much together, and we went to the Judicial College. Judge Willis was a part of the beginning, and he went with us to the Judicial College. We attended several sessions, weeks of training to start a mental health court, and it was cumbersome to do this. We came back. Judge Willis never actually sat in mental health court because we decided that it would be best to have the continuity of one judge, doing it, because there's a reason for that, and so that's the way we did it. So we had to we started without any money, really. We started the team without any money. The team, so you know, consists of the judge, the leader of the team, and then there's the prosecutor. And we're fortunate in Carson City to have the prosecutor on the team. And now Jason Woodbury, our district attorney, is very supportive of specialty courts. And it makes it, some communities, the prosecutor doesn't participate. They're starting to more and more now, but here they do, and that's a great thing. We have the public defender's office, and we have, in fact, right now, Karen Kreisenbeck, the state public defender, comes to mental health court every week because she believes in it so much. Joe McEllistrem is a part of the team still. He comes every week, which sometimes is, it's always good, I guess. We have, you don't know his humor. It almost came out at one point during this. It almost came out. It's part about the dryer, but we'll talk later on that. And then state mental health. We had, I don't know what their actual agency's called, but it was
Department of Public and Behavioral Health.
them. And they had to buy in. And Sheila Leslie was a state legislator back then, and she was very, very supportive of specialty courts. She came to me and said, at one point in the process, said, would you like $100,000 to fund your mental health court? And I said, I believe I would. And so that really helped, and that was a big part of us continuing with mental health court. So now so what happened with that $100,000 was the funding, it didn't come to the court, it goes to Carson Rural Clinics, which used to be called Carson Mental Health, then it became Carson Counseling and Supportive Services, and then it became Carson Rural Clinics, and now it's Rural Clinics, hyphen, or maybe a comma, Carson City. But that's a good thing, because they all have reasons for those name changes, none of which I ever understood. Anyway, they provide, the $100,000 provides a salary for a caseworker, Marcy Best, who does a phenomenal job. She's a part of, that's all she's devoted to mental health court. And then the remainder of the $100,000 goes to help people with housing, or sometimes we help people with dental needs, whatever we needed to help with, we helped with. Drug testing, those sorts of things. So I kind of jumped around a little bit in case you didn't notice. But another part of the team that we have now is Dave Ramsey. He's a nurse practitioner who did work for the jail, and now works for Community Counseling Center, I believe. Yeah. And he's a nurse practitioner who dispenses and prescribes psychotropic medications to participants, which is a fantastic thing, under the tutelage of psychiatrists at Carson Rural Clinics. So what happens is we have this team together. We got the team. There's law enforcement, prosecutors, counselors. It's an odd combination. Defense attorneys, people that usually aren't, buddies. And we all come to the table every week and meet, and it's the greatest thing you've ever seen. It's so cool to watch how we can move people through that court and learn about them and understand what they did last week and help them. So the way it works is somebody first, they have to get arrested. That's the key. So they got to get arrested. They have to have a criminal charge, and then they'll get in the system. And then as a part of their resolution of their case, they can volunteer. I don't do air quotes. I hate quotes. But they can volunteer to be in mental health court. It is a voluntary program. It has to be voluntary. We can't force anybody in. Once they're in, we can keep them, but we can't force them in. And so their attorneys, they negotiate the deal, and ultimately it becomes a part of the deal where they attend mental health court, and they have to start attending. Weekly, they must come to court. So, and the qualifications, they have to be mentally ill, and the qualifying diagnoses, and correct me if there's schizophrenia, bipolar, severe depression, PTSD, and lots of combinations. And the interesting thing is that probably 5% of everybody that comes through mental health court who has one of those diagnoses also suffers from an addiction issue, a substance abuse issue. So that's the criteria for getting in. We can only have 35 people in mental health court because of funding, and that's all Marcy can manage. However, right now I think we're at about 42, or they are. I'm not there. I would keep it under the cap if it were me. All right. If they're not admitted into mental health court, then many times they're sent to misdemeanor treatment court that Judge Armstrong runs, or sometimes they'll go to adult drug court or DUI court or some other specialty court, or sometimes they're just put on probation, and it's better to monitor them under those conditions. So each week we have mental health court. And mental health court consists of a half a day. So we have staffing at about 1:30 p.m. And the staffing is where we all sit around and discuss new participants, should we let them in, should we not. And then we discuss the current participants. And we talk about each and every individual and what they've done the last week. And the great thing is, this is what makes specialty courts work, is that the counselor's there, the probation officer's there, everybody's there, the mental health counselor, we get all kinds of information. Every single week we discuss it. So if they're going to, slip, or they're going to use, or they're heading into relapse mode, or maybe they've stopped taking their medication, we're going to pick it up quickly. That's what makes specialty courts work. So that week, hopefully we pick it up and we do something to correct the problem. And that's, of all the specialty courts, that's the secret to success. Having everybody at the table and then dealing with the issue right then. Sometimes, and the way we deal with them are, like say they use methamphetamine. There are several things available. It could be that they go to jail. And sometimes that has to be the option. They need to go to jail. They need to know they can't do this, or sometimes they need to go to jail because if they don't go to jail, they're going to continue to use and there will be a problem. So that's the ultimate sanction, is going to jail. But then there are other things like do community service. We make them write, and things other than methamphetamine. We make them write essays like why, like maybe they got in a fight with their roommate. So we make them write an essay, a couple-page essay. Write a paper on respecting your roommates. And it makes them think about what they've done. And they come in and we make them read it to all 40 participants, 35 participants, what I mean. And we make them read it, and it's therapeutic for them to go through this. So those are kind of the sanctions, some of the sanctions. There's all kinds of other things available, and that's where Judge Armstrong is very creative in the sanctions. He's very creative in those. Incentives are another thing. Like one of the greatest incentives is just we all clap. I got 90 days sober. We all clap. You can't believe what that does to them. It's that recognition that they don't get. Everybody's been telling them a long time that they're not going to make it. They're no good. Please go away. So they get this recognition, and then pretty soon it's pretty cool. And they're coming up and go, I got 61 days. Well, you had 60 yesterday. We clapped for that. We're not going to clap today. So we give them movie passes. We have a little fun for that. Movie passes, haircuts, bus passes, things that improve their lives but are cool for them to get. So each week, they come every week, and then as they come, we extend when they have to come. Then they come every other week, or once a month. It's usually the longest period of time that we can extend. And it just invokes trust in them. And they know we trust them. We tell them, I'm proud of you, I trust you. And that means a great deal to people. All the studies have shown that words from a judge like that mean a lot. So I'm running out of time and I'm rambling, but some of the things that we do too, just so you know, when we send somebody in, what they have to do, they have to go usually to, lots of times to an inpatient substance abuse treatment program, 30 days. They get out of that, they come back. They go to IOP. IOP is intensive outpatient counseling. That's 3-hour sessions, 3 days a week. That's 9 hours of counseling. Plus, they're going to mental health counseling, at least 2 hours a week of mental health counseling. And then they have individual counseling. And then we have them go to 12-step meetings, and then they do community service, and we make them get employment. We push them to get employment. Many aren't ready in the beginning, but that's our goal, is to have them independent and self-sufficient. And we've had great successes with that. I've seen people, my wife and I were at the Apple store not long ago, and I look over and I see this guy working there, and he's a genius at the Apple bar, or I don't know what to call it. Not the kind of bar he used to hang out at. I'll put it that way. And I was like, oh my God. I was shocked, because this guy was a guy that his parents were afraid of him, were worried for him. They had to lock the door of their bedroom because they were afraid he might come in and do something to them, violent. He was terrible happening in their home, or something terrible happening to their mentally ill child, because they become victims. That's a big part of mental illness. They become victims out on the streets and out in public. And so I feel very proud that I've been through that. I probably missed things that I should have said that I had written down, but I couldn't read them. Because I'm getting a little older than that picture, but anyway, and the last thing I wanted to say was Kristen Lewis is my replacement. And she is 100% into mental health course, a specialty course. She will be there. She's going to she's going to take it from here. She's been coming to mental health court and participating and thinks it's a great program. So I'm very glad to say it's going to continue on. But thank you.
stories, people with mental health issues, all the stuff we're talking about. She came in, she sat at my table, and she blew me away. She gets it from all aspects. She sees it from all sides. She is energetic. She's smart. And lots of times when we're speaking with the public, the court challenges aren't easily seen by the public a lot of ways. We have constitutional concerns, due process concerns, and representation concerns that don't apply in the hospital, for example, or don't apply to the places. I bring these up, she addresses them, she assimilates them, and comes up with a solution and workaround instantly. So Jessica has been in the role of the Regional Behavioral Health Coordinator for the Carson, Lyon, Douglas, and Churchill, Mineral, and Story counties. In this position, she works with community stakeholders, including law enforcement, fire, social services, mental health and substance abuse providers, family and peer advocates to collaborate in developing and coordinating behavioral health resources within each county and across the region. In this capacity, Jessica also serves as a liaison between the communities and state agencies and supports the newly established Northern Regional Behavioral Health Policy Board. Her focus on community partnerships has facilitated the reduction of silos across the region. That's the key sense of the bio that I took from this. That's what she was doing in my office, and that's what we're continuing to try to do. She serves as Vice President on the Board of Directors for NAMI, Western Nevada. Her background includes experience in acute medical and inpatient psychiatric social work, as well as outpatient mental health counseling and discharge planning. She received a Master's of Social Work from the University of Nevada and currently teaches students in the Bachelor's and Master's Social Work program at the university. Let's give it up for Jessica Flood.
Good evening, everyone. So I just wanted to say that when I came into my role in 2015, what Carson was doing was really incredible, and Kathy wasn't kidding when she said that all of the other counties wanted what Carson had. We had this regional behavioral health coalition, and when I first started, it's kind of like, well, what do you guys want to do? How are we moving forward? And Douglas, Lyon, and Churchill all said, we want what Carson's doing. They were really impressed by the FAST program, the MOST program, and the crisis intervention training. And that's been a huge focus of our role, or of ours in the regions for the last few years, is really duplicating what Carson is doing to the outer regions. So I can definitely say that Carson is the leader of rural mental health, especially in terms of the criminal justice system and that interaction. So I want to tie all of the discussion that happened tonight together with the sequential intercept model. This is a pretty amazing model because you hear of all these programs and it's kind of hard to visually place where they might be across a continuum. And this model was created back east, and it provides that continuum so that we can really organize our interventions. We're identifying opportunities where we can intercept individuals as they move deeper into the criminal justice system. So I'll just talk you through it because I'm sure it's hard to read. You have Intercept 0, which is community services. That's really the crisis care continuum. Intercept 1 is where individuals start really coming into contact with law enforcement. So that's where CIT and the mobile outreach safety teams are. They're pretty early interventions when it comes into the criminal justice system. Intercept 2 is initial detention and initial court hearings. That's where we start seeing FAST come into play. So an individual comes in the first day, they've got some mental health issues going on, and Doc Joe is alerted and comes and does a screen. And then he immediately refers to the FAST team who starts to get on board, trying to stabilize the individuals and get them into groups, hopefully. I just want to jump to Intercept 4. FAST is with them all the way from 2 to 4, and you see FAST at re-entry. So FAST is trying to discharge those individuals out, back into the community, hopefully with discharge plans so that they don't get rearrested. And then specialty courts are in Intercept 3. So that's where someone's been in jail and one of the judges gets a referral and decides to accept the case. And when they're talking about the spin cycle, you can almost visualize the spin, right? Individuals move through the 5 intercepts, back out through the community, hit law enforcement again at Intercept 1, and keep moving through. So, I just want to say though, that when I first started, there was a ton of success that had happened in Intercepts 1 through 4. But everyone was saying how important Intercept 0 is. That's where the true success would be. Sheriff Furlong would agree. Even when I first met with Judge Armstrong, that's what he said. He's like, oh, this is all well and dandy that you're trying to do all this stuff and all these other intercepts, but really true success is people not interacting with law enforcement. And that's really where we had the gap. A funny story, I'd say that this is my greatest failure, is when I first started, the other task that people put on me was that I should create a crisis triage framework. And I tried mightily, probably for the last 3 years. Every year there's a couple of additions that I come out with, and everyone goes, no, I'm not going to use that. And I realized part of the reason is that we didn't have any crisis services besides jail and the ER and the mobile outreach safety team. So you can't really do much with all of those. You're just pinging together. Yesterday, we had a really exciting meeting because right now in this community, we're building crisis services that are in between the ER and jail. And that's what I'm going to talk about right now, or some of the hope that is being brought into this community right now. So the 4 levels of crisis triage that we have in the community right now, or that we're going to have, are certified community behavioral health centers, which I'll talk about, social model detox crisis services, which we've had forever, that's Vitality, the Mallory Crisis Center. Who here's heard of the Mallory Crisis Center? A few of you, that's good. So we'll talk about that. And then we have 2 truly innovative programs coming into Carson City. Assertive Community Treatment, it was created to stabilize superutilizers. And then we're having First Episode Psychosis, which is probably the most revolutionary program that I've come across in mental health, and definitely in America. So I'll talk about that as well. So certified behavioral health clinics, the most confusing name that you can put to any model of care. But, so this came from the federal government. They created this program that's really meant to be the center of a person that has a lot of behavioral health issues. So we all have primary care doctors, but often primary care doctors aren't enough for individuals with behavioral health issues. So this model is truly like primary care flipped on its head. So it's a behavioral health home that works with primary care to coordinate care. So you can see that they're supposed to be coordinating with the FQHCs, the Federal Qualified Health Clinics, schools, substance use clinics, Veterans Affairs, hospitals, all of these. They rolled out in Nevada in 2017. There was one in Fallon, another one in Elko, and then one in Washoe, and then Clark. This year, Carson City is getting 2. It's the only community in Nevada that's getting 2. So Community Counseling Center is going to become one and is funded by the state of Nevada. And then Vitality, out of nowhere, got this federal grant to become a CCBHC as well. So talk about a huge amount of resources coming to Carson City in a very small amount of time. To dig into what that looks like, because I've seen other communities really struggle with what is a CCBHC, it's really a beefed up outpatient clinic that's able to provide 24-hour crisis services, including mobile outreach, screening, assessment, and diagnosis, all evidence-based, person-centered treatment planning, evidence-based outpatient mental health and substance use services, so that integrated care that we rarely see, especially in Nevada. Peer support, and then it's really focused on members that are veterans, which has always been a gap in Nevada as well. So when we were doing the crisis triage mapping, that would be considered kind of a lower level of crisis services, and that's nice. Because when I talk about Mallory Crisis Center, that's not everyone's best day when you're walking in there either. It's a pretty high level of care. It's a hospital environment. These CCBHCs, what they're trying to create are crisis services that are like living rooms. They're literally going to create rooms where people can come in and lay on recliners so that they can just take a deep breath, try to gather themselves, and maybe re-enter the community that day. So think about that when I start talking about Mallory Crisis Center, because that's really the higher level of care of crisis services. And again, it's an exceptional program because it's the only psychiatric ER in Nevada. We've had people from all over the state come and visit Mallory Crisis Services because they realize that it really covers all pieces. Like the CCBHCs are great, but you can't take someone with a legal hold to a CCBHC. They're immediately going to have to transport them to an ER. Mallory Crisis Center was truly set up so that law enforcement can drop people off that are in really pretty severe crisis and are in need of legal holds, and can do so knowing that those people are going to be safe, that there's no more transportation after that. And it also is a great hospital ER diversion. In fact, when you send someone to Carson Tahoe ER with a behavioral health crisis, there's almost 100% chance that they're probably going to end up at Mallory Crisis Center in the next couple of hours. And I have to say it's such a hopeful place because we talked about how ERs are not the place for people to be. I've seen how nurses interact with individuals with behavioral health issues. I bet a bunch of you have as well, and it's not always the most pretty sight. It is kind of this is not where you're supposed to be. I'm not trained to do this. And I worked at Mallory Crisis Center when it first opened, and it was so cool because you have people there that are really passionate about mental health, and people would come in, they're like led by the law enforcement officer, and we'd be like, welcome, come in, we're here for you, do you want some Coke, Coca-Cola? But the thing about Mallory Crisis Center that was not always that fun is, I told the sheriff yesterday, sometimes it was like a hammer crushing an ant. So someone's like, oh, I'm in crisis, I don't have my medication, but I'm still doing okay. We're like, okay, you're gonna have to take off all your clothes, put on hospital garb, and then you're in. And they're like, what? It's kind of terrifying for a lot of individuals. So that level of care does not need to be for all these people, often who are in minor crisis or even moderate, you know? We saw people who their spouse cheated on them, and they're like, I'm momentarily suicidal, I need help, I just need somewhere to sit. Wouldn't that be nice for them to have a living room to go sit in that's neutral, to just have someone to talk out their life problems so that they can get back out into the community? I've got some stats on Mallory Crisis Center just because I think it's really telling to see the success of it. From the very beginning, we really pushed for that. There should be almost no denials because then law enforcement is not going to use it. If we go, well, that person, but we're not going to take that person. So they were very clear in their guidelines. They will almost take anyone unless they have a blood alcohol level of above 0.3. And like Doc Joe, that's what I was thinking about Jane Doe, right? That's how high 0.3 is that's now you have to go to the ER. And if the individual's violent or if there's like actual wounds, then Mallory can't take it. But besides that, they try to take everyone who comes in, and they try to get law enforcement in and out within 5 minutes.
Wow.
Yeah, and I think they do a pretty good job. And they have a really good partnership with law enforcement at this point as well. So I have over 2,300 were referred since opening. That's actually what is that called? It's from like last year. I'm sure there are over 3,000 that they've had come through those doors with just 10 beds. 36% were referred from the ER, 28% from law enforcement, and then walk-in is 53%. So a little known fact, people can just walk up to the doors and say, hey, I'm in crisis, and we're taking a huge percentage of those people. Other facilities also send people 4%, that's probably like Vitality or rural clinics if they can't talk someone down. I want to point out this 399 who are repeat clients, 17.25% of the overall visits. Even with all the interventions that we've created, there's still people who are really pretty, they've got serious mental illness, they have a lot of disability, and often our society is not quite, we don't have the supports that they need to be able to live happy, meaningful lives in our society. So they still end up in these places, and that's where these next programs really come into play. So like I said, that's where assertive community treatment happens. Other states in the U.S., this is a very popular program, and Nevada has tried to develop it at times in the past, but has never quite been successful. It's really focused on those individuals who need intensive supports. And this program is focused on doing whatever it takes to keep those individuals stable. So it's not about that model where the provider says, well, you didn't show up those 2 times, so I'm afraid I'm gonna have to fire you. This program is like, there's no firing allowed. If the individual doesn't show up or goes off the map, they're doing everything in their power to try to track that individual down and just reconnect with them, keep them stable. So Vitality and Community Counseling Center, both the CCBHCs are supposed to roll out assertive community treatment in the next year, as is Carson Tahoe. So I don't know if you're aware of how many resources are coming into Carson. There's entire counties, many actually, there's probably 13 counties in Nevada that aren't even going to get anything like this. So it's kind of extraordinary, and this could be a really good pilot to see when a community gets all the resources it needs, how does that affect the sheriff's numbers like he was talking about? Okay, this is probably the most exciting program. First episode psychosis. This is for individuals at the very beginning of serious mental illness. This is in the first 6 months to a year when someone's identified. That you take that individual and instead of what the American model kind of has been in medicine, which is to allow that individual to evolve and kind of watch this avalanche, and then try to take care of him in an inpatient hospital or in a jail. And at that point, after 20 years, often they're pretty debilitated. So this instead is right in the very beginning saying, we're going to put an immense amount of resources right up front to try to keep that person with their families in strong relationships, keep them in school, keep them in work, keep them off drugs and alcohol, and really try to do it in a client-centered way. So not just say, this is what you're going to do, but what do you want to do today? What's your passion? You know, how do you want to be healthy? Do you want to go to the gym? And they really will have someone that just walks with them, trying to keep them on the right path so that they don't have so many drug and alcohol episodes that they kind of ruin their mind, which is often what we see in inpatient. It used to be really sad. So the program's rolling out February 4th from Carson Tahoe. Yeah, so it's not one of these things that in the next year, this is actually about to happen. But it used to be really sad when we saw these young, teens, 20-year-olds who come into Carson Tahoe and you just think, man, first episode psychosis, they've got a long life ahead of them. And it's great to know that instead of just watching them kind of devolve, we will have supports that are really doing everything in their effort to keep those individuals going. Okay, so the next big thing that we're working on is called Crisis Now. And this really fits into everything that Carson has been doing. The idea around it is there's 3 pieces to it. We're going to use the Nevada Crisis Call Center, community-based mobile crisis teams, so that's the MOST team, and then crisis triage centers, like the Mallory Crisis Center and the CCBHCs, and really creating a cohesive system so that people can use the crisis call line. The crisis call line can call MOST, and then MOST can drop people off at the options. It's finally, hopefully going to be a truly workable, cohesive system. I just want to point out that for the mobile outreach safety teams, they're obviously a huge success. And Assemblyman Kramer has a bill right now that's going to legislature asking for $2 million for 2 years of funding to roll most out to all 15 rural counties, including Carson. So the sheriff always talks about how important the rural clinics and his relationship is with them to be able to have Becca Bach. Becca Bach is worth $1 million. But so this funding can allow that position and that relationship to be sustainable. So I just want to throw that out there. And that's all I have.
There at the table here, we're going to start with one for Dr. Joe. Well, it's one here for me, but we'll just shuffle out the back of the list there. Dr. Joe, what is co-occurring disorder? And how do you decide what to treat first, or how do you treat it? I think that's, there's probably a lot of that. We're talking some technical stuff here that maybe people who are involved in behavioral health understand. Co-occurring is one we use all the time. So, Dr. Joe, you want to take one?
So what we talk about when we're speaking of co-occurring disorders, that means that we've identified two distinct diagnoses that in and of themselves would exist independent. One didn't create the other. And so it's typically in our cases some kind of an axis one or mental health clinical disorder, schizophrenia, bipolar, combined with an addiction. And so that's typically what we talk about co-occurring. So they're uniquely independent of each other, can be diagnosed separately. But when they occur together, the treatment needs go up exponentially, and success rates are affected by that.
So to put it in perspective, a follow-up question for Judge Tatro here. What percentage of mental health participants would you consider co-occurring?
95.
Misdemeanor treatment court, where the mental health needs of participants are far less than what is required or what is appropriate for mental health court. I would say at least 50% co-occurring subpatches. So the two, substance abuse and mental health, are inextricably linked for a variety of reasons. And how do you decide what's the treatment option? Treat them both together, or treat one first and the other? How does it work out there?
So one makes the other vulnerable, right? So if you're not treating them at the same time, you're really going to complicate matters. So if the addiction's not treated and you're trying to address the mental health, they might be using while they're also trying to take their psychiatric medications. And what we found that addiction and using those substances, it really acts like rocket fuel. So if you have someone that's struggling with mental health symptoms on a scale of 1 to 10, or at a 5 or a 6, you add substances on board and they'll escalate to a 9 or a 10 pretty easily. So if they're not addressed, it becomes a vulnerability. So if you don't address mental health needs, they might relapse. If you're not addressing the addiction issues, the ability to be effective in their mental health needs goes down.
Can I just add in really quick?
Sure.
So that's why we now use the term behavioral health instead of mental health. It's really hard to tease substance use and mental health apart, and so that's now the term that's used.
All right, so this is an important question, so I want to make sure we have plenty of time for this one. And this one's addressed for Jessica, but I believe everybody here can have some input on this one. What can friends and family members do to intervene with an adult with behavioral health problems? Can they request 72-hour holds, for example, or what options might be available to somebody who we care about or who we know needs intervention? Let's start with Jessica. Go ahead.
So I just wanted to throw in first, what can you do to support someone? Is like treat them, I'm saying this like with so much love, but treat them like a human. There's a great, if you look, there's like a video series with Glenn Close. She's a big mental health advocate. And it's like, what to do with someone who has ADHD? What to do with, and basically the gist of it, you guys should all look it up on YouTube, is being like, oh, I'm so sorry you're having a bad day. You know, that's the true social work skill. That's the magic. So I just want to start out with that part.
What about more formal interventions? Someone's in crisis, someone's on the brink of crisis frequently, family member, friends are living with this, and they don't know where to go next. where can they go?
You want me to say a little more?
Yeah, just start and then we'll go down the line.
Okay, so it depends on the level of need. Like what I just spoke about is really those resources for that person. If they're voluntary, you're lucky because you can probably get them to go to a CCBHC or Mallory Crisis Center. And I just want to say Mallory Crisis Center is open now. The CCBHCs are just being developed, so I don't want to lead you astray there. If they are involuntary, I think that's where most comes into play, and most can put on a legal hold if needed.
So Dr. Joe, can you explain the 72-hour hold and how that works? Because it's specifically here in this question. What does that mean? Who can do that and how they're implemented and why? Just got to agree so we understand. That, I think, is what you say involuntary, is I believe it's referring to, right?
It's a civil procedure where you're basically asking that someone's civil liberties be suspended for up to 72 hours because they represent a risk to themselves or others.
Immediate, right?
Immediate risk. And so there's really 4 criteria, and generally it's a risk to self in terms of being suicidal. It's a risk to others being perhaps homicidal. It's the inability to care for oneself. So you might have someone that's not threatening themselves or anyone else, but you can see they're so debilitated by their symptoms in the moment that they couldn't access shelter, nourishment, and make healthy decisions for themselves without being intervened on. And then the 4th one, I think, is the self-mutilation or self-harm. So we had a guy in the Douglas County jail that was transported to us from the Las Vegas jail, and he took his eye out. So it's a self-harm behavior, and that I tried to bring up as an example. See it, you're welcome. And so, and he was going for the 2nd, and he got a little bit of it, and the deputies were able to free him. So, but he was in a point of psychosis, which is often the case with those kinds of issues. So what it allows you to do in these cases where someone's in imminent risk to themselves or others, you can put a hold on them that then allows them entry into a mental health facility. But it is against their will for that 72 hours, unless the district court judge extends it. So it's time limited, but it's a way to get somebody immediate care for a crisis situation. So there's different aspects to that process. But law enforcement can make application for it. I can make application for it. There's a host of people that can make application, and then it goes to the hospital, and they'll certify that. They'll look through the application, they'll meet with the individual and say, I agree with that application and the reasons for it, and then it's certified. The issue for us has been that's a short-term intervention. What we really like to see is at some point during that 3-day stay that they go from involuntary to voluntary admission and stay longer if need be.
So it's a short, it's specific, it's short-term, it's designed to resolve immediate serious harm, but and there's a lot of legalities, like, you have to have certain criteria have to be met. Judge Tatro. Intervention, this is why I want to drill down, and I think it's important.
So if they're in the
Living
system,
with this, where do they go? Where do they start?
if they're in the system and they've got past the 72-hour hold, then as a family member or a friend that is concerned, come to court, come to their court appearance and stand up and tell the judge they have a behavioral health issue. Tell the judge, tell the attorney, tell their attorney, tell the prosecutor, because as soon as, when I'm in court, and I know Judge Armstrong does the same, if a parent stands up and tells me that my son is suffering from schizophrenia, he's acting out, he's this, he's that, then I will take steps immediately to get Dr. Joe involved, to have him looked at for mental health court, to maybe see if they need to be shipped out for competency. Is that for me? Competency. Sounded like my wife's phone. Oh, it was. I knew that ring. Anyway.
So, sure. Lots of times the intervention is calling 911, right? I mean, the acute, we're in crisis, those to do the call 911. Is that a viable option? You encourage, you have nowhere else to go, you told them to call?
Absolutely. In fact, I would just bring forward a notification that we received in today. Person's behavior, his suggestions were somewhat threatening to the community, we immediately determined where he was at, where the family was at, any co-workers and such, began that interviewing process. How readily accessible or amenable to services that we might be able to get onto this person right away. Again, the challenge up front is to keep them in their homes and with their families. But at the very onset, if notification comes in, we want that background information, and truly the families know best. They can give us the most valued information that will allow us, our mobile outreach teams, to make the contacts. And folks, we're doing that every single day. We call it a risk assessment, and be able to determine whether or not more services put on this table are going to be the inevitable outcome.
To speak for Becca Bach.
She's okay with her?
Yeah. Yeah.
Say it, my picture was not as old as yours.
So I just know if Becca would be here, she would say when you call 911 that you should ask for CIT or MOSE, and that helps them quickly identify that this is a mental health issue, and that they'll be ready when they come on scene for some mental health situation.
I will say this, there's a lot of variables in that question that was hard to address all of them, right? Is it, you're living with somebody who you know has issues, you're not quite sure what they are they criminal involved, is there an actual crisis, is it, what's happening, there's different levels for resources available. I will say this, in my court, when someone's having a someone stands up and says I have mental health issues, my question is, okay, well, what's your diagnosis? Well, I don't know, I've never had one. Have you ever been, I don't know. But if you think someone you love, someone you care about, and has mental health issues, go see somebody. Go see somebody. Get a diagnosis. You know something's wrong, but unless you know what it is, you don't know where to go. So that's the early, voluntary, early stages, right? So often, the stigma's being erased, but so often people just are resistant and don't want to go. So that's my 2 cents. Sheriff, does Carson City or the state of Nevada have a process in place to keep guns out of the hands of people with mental health issues?
Wow. Yeah, that was all the time we had. Yes, we do. But it's probably one of the most challenging, and all of the sheriffs several years ago got together in the state. It's probably one of the most challenging features of our gun rights. We respect the HIPAA-protected privacy of persons, especially those that are going through voluntary treatments and such. So we do rely a lot on informal reporting or informal reporting by law enforcement agencies around the state. But the fact of the matter remains that a person with a mental health or behavioral health issues can get through the system just because there's not adequate reporting, call it databases. I believe that is singularly one of the greatest opportunities we have in the future is to create a trustable ability to communicate those circumstances to law enforcement agencies that are authorizing or at least clearing the right to own and possess weapons. Does that answer your question?
I think that's good.
Okay.
Anybody else want to weigh in on that one?
Thanks, guys, having my back.
There's a question about mental health courts. How long have participants been in the program? Or at the weekly meetings, are all the current participants in the room with all the service helpers and sharing their last week with the other participants, similar to a 12-step? So I guess the question is it everybody chiming in at once? I don't think the bifurcation between staffing was clear. So, go ahead.
So, like I said, there are 35 participants. They come every week when they first start, and then it gradually works to where they're coming every other week or once a month. So some weeks, yeah, everybody's there. In staffing, it's just the team. It's just the team and staffing. That's when we talk about the participants, and that's when each member of the team gives the input that they have, what they know about that person for the last week. When we go into court, pretty much the judge and the participant do the talking. I might call on somebody and ask a question. For instance, if a defendant is denying something or a participant's denying that they did something, I'll say, well, Mary has a little different view of what happened, and I'll ask. But no, it's not like an AA meeting. It's different than regular court, but it isn't just open. It's not like an open mic where everybody can just jump in and participate. It's not like an AA meeting.
Yeah, I think so. So, right, some things are discussed behind the curtain
Right.
amongst all the professionals, and then the court is open. So everyone can participate and see how in court, but not everything is discussed in open court.
Your Honor, I'm going to interject for a moment because people are starting to leave. Please, please, please fill out the survey. This is how we get grants to support this kind of phenomenal work. Sure, yeah.
All right, Sheriff Furlong, there's two for you. There's two questions that are kind of the same. Why are level 1 crisis calls up 600% since 2003? And the follow-up, if your car started using 600% as much oil, you would not only want to know why, you would be asking how you could better manage the supply of oil. So, do you have an answer for why? And I think this is addressed to you, Sheriff. I think everyone here might have an idea of why the increase.
I think so, and I can probably open the gates with this. Identify a challenge and begin to put resources on it. You are going to create an opportunity for we began this process, and as we developed resources and outreach and responses and training, what we realized was that the challenges that were out there were greater than we realized before, if that makes any sense to you. It goes to the issue of, well, I didn't know, but now that we're applying resources, we're trying to get our arms around the bulk of it. And so I think that many people who were hidden or not known in the past, today we are working with. And I think that's one of the bigger credits to our response in this community, is fewer and fewer people are left with no information. They have some information, they have some ability and confidence to reach out, and therefore those numbers are climbing. I'm going to leave it to Doc Joe as to, and others here, as to why our society seems to be stressing more and more and becoming and falling into critical places versus the past.
I want to direct your attention to a couple of things. Like, for me, some of this seems to be the issues of behavioral health kind of still coming out of the darkness into the light, right? Like, we're all here talking about this. I can't imagine us discussing this 10 years ago, right? And so now everyone here knows that they can make a call and get help with the crisis, right? And this has been building. So I think some discussion about how our mores, attitudes have changed in mental health, I think might be instructive as well. It's not necessarily, I don't know, don't get me wrong, there's that many more issues. It might just be access to services and knowledge of how to properly address those. Either one, I think that's good for either one you can
I agree. I don't know that difficult times will present themselves throughout the course of history, but I think in this case, there was a time when people didn't believe law enforcement had the answer. So there was less calls. Or the answer really was arrest. Now, with the CIT trained officers, I think people are starting to realize that officers are approaching these challenges in a much different way, and that the criminal justice system actually has a response for them now. So if they come into the system, we have the option, maybe they're diverted right at the street level through a most intervention and they go to a hospital. So law enforcement's involved, but a criminal case isn't developed. Or if they come into the jail, there's treatment in the jail, there's access to services in the jail, and now there's treatment options long term through MAP court, misdemeanor court, mental health court, drug court. So because of the treatment availability, I think people are more comfortable seeking out law enforcement to help them.
Then I guess this is our best guess, right, on this issue, would you say? I mean, is it more than a best guess as to why, if you're our best to answer the question, I don't really know the answer.
Well, there's a couple of things that I just, to addition, because I think that there's something to this. So Nevada is 51st in the nation for mental health, and you can see how much progress we've made, but I think there was a real lack of hope for a long time that people could get
Do
services.
you mean mental health services,
No,
or
like-
people who live with behavioral health issues?
Both. So it's like 10 indicators. If you look at like what the indicators is, it's like percentage of people with serious mental illness, access to care, like youth suicidality. You know, you add all of those up and you end up with 51st for Nevada. And we actually are like, we've got a tail. It's not like we're just like barely edged out by 50th. And that's including Washington D.C. for whoever's wondering. So before we had the Affordable Care Act, people really didn't feel like they could get services. They didn't even feel like they could go to the ER because they get charged this huge bill. So we have seen a dramatic increase in people trying to seek services. On the national level, I went to some suicide conference, and they do talk about societal factors, unfortunately, about how we're more isolated. Our society is just getting more isolated, so it's causing the more stress that you were talking about.
I watched a documentary on longevity, and one of the factors on living a long life was strong family, community bonds, right? And it seems like maybe some of that's breaking down. This one I think is important. I think for people who, the programs mentioned all appear to be on an individual basis. Are there any now, or are there any planned future enhancements to help the entire family? And if they're so, what's out there, what's the those families? Because this is a family problem, not just individual problem.
Yeah, so, should I? Yeah, so Dr. Joe just said NAMI, National Alliance on Mental Illness, our Western chapter has really, I was just thinking how that should have been a bright light on the PowerPoint, because they just are rolling out a warm line, actually, to do follow-up for all of these services for MOs and in the jails. And they have family-to-family trainings to help families feel more comfortable, like I was talking about, just working with their loved one. They have peer-to-peer trainings to help peers, like these people with mental health issues, feel more comfortable in society and have a social network. So really powerful work, and they are kicking ass. I mean, they're really going all the way out into all the worlds.
I will say, when we developed this, we were brainstorming the presentation here, we realized that this was a much bigger issue than what we've been talking about today. So today's portion is the intersection of criminal justice, law enforcement, and mental health. There's a whole other presentation down the road. We might have something a little lighter in the meantime regarding all the other, where criminal justice is not involved, right? And that these are burning questions for families who live with this and people who live with this, but we are here. It's out there. That's why I brought it up. But this is about criminal justice, law enforcement. That's kind of the focus for today. But it's a much bigger issue than just law enforcement contact.
I do want to say that the next step for FAST, I think we are looking at more peer and family involvement. Just at a national level, that's where they're headed. And so we were just discussing how to incorporate those pieces into it.
Well, there's peer and family involvement, but there's also the family that needs to take care of themselves, because so much of the focus is on the loved one struggling. But it's absolute agony for a parent. And they need to be able to reach out for resources and not go through this alone, and know that they exist. And I think even the IHOP shooter, we learned the family was just agonizing over their son, not knowing who they could turn to. And so to go through it with them and be the primary support without having a supportive network around you to go through it with you is a painful process. So,
Can you just touch on the stigma of reaching out? We're still trying to break that. It's not a bad thing to reach out. It's not a bad thing to say, I need help, or my family member needs help. But that's still a challenge today, to get around that corner and say, these are protected private things, and we respect them. But that may lead right straight toward, why are we seeing it burst now? We're breaking the stigma, I think.
I just want to be super clear, because I think this is very important. NAMI has a number. And if you're someone who has a loved one and you don't know what to do and you're feeling stigmatized and uncomfortable, you can call that number and talk to another family member who has someone who also has a mental illness. So that is the strategy. Because sometimes we talk about this and it's all kind of unclear. People go, so what do I do? I call Nanny.
Right, and that number is, here we are, 775-440-1626. So we'll be part of the second round of this discussion as his honor said.
Kathy, I have a few more. You want to keep going?
Sure, go ahead.
Okay. So, I have a question here, these are two I can kind of join together. One is how are these wonderful interventions being paid for? And there's another question kind of along the lines, are churches involved? And where do our nonprofits, our private people out there that are helping the community, where do they get into all this? The churches, the nonprofits, the charities, how does it all fit together, and who's paying for some of these new programs that come on board? Do you know the answer?
Oh yeah, totally. That's like half my job.
That's what I'm saying.
Yeah. So FAST and most, we were incredibly blessed from the state to be able to get pilot funding. So when Richard Whitley came to Carson, they gave money to Carson to have these programs. And this is really a pilot, and we're trying to get sustainable funding for both. That's why I mentioned the legislation for most. And for FAST, that's the next hurdle, is trying to really get that sustainably funded.
Criminal justice system wants to reach out. How do they get the assessment?
So they can go to Mallory Crisis Center. And that's the thing. So Carson Tahoe, doesn't seem like it, but they are a nonprofit. And they are actually funding that entire crisis center. I just want to say that they're losing like $700,000 a year on the Mallory Crisis Center because it's actually not sustainable. And so Washoe Behavioral Health Policy Board is trying to get their own crisis triage center funded, but we do need to figure out how to fund crisis triage centers. That's the answer, and we haven't found it. So we're just really lucky in this community to have that be what is happening.
And so I think Judge Tatro, mental health court, for example, was what? It was allocating existing resources to emphasize solving the issues to be solved, right? There was no grant money, it was just people already doing the job separately, willing to come in, spend their time to try to make something happen, right?
Getting the agencies to participate and be involved. Before the funding actually came in, there was no funding.
And Dr. Joe, your same thing, right?
We started fast, we just asked people to volunteer, and I'm still a volunteer. So I don't take anything for that. It goes to the boots on the ground and the people providing the services. But like mental health court, we all volunteered our time until Sheila Leslie came forward as a FAST team that we developed. Once people see what you're doing and it works, they come forward and try to find ways to help pay for it and make it sustainable. So Kathy Bartos, who's here tonight, was instrumental in getting us a 2-year federal grant after about, was it a year or two of running the FAST program. Nothing but volunteerism and people agencies willing to dedicate staff members to the positions.
So these people have been doing the work for a long time, but getting a big part of it, I think Jessica can probably touch on this, is not just people doing the individual pieces of work, but getting them to work together, right? So I think this is kind of the capstone of what we're talking about here today, right? So I think if each one of you could talk about that piece, it's not just about where the money's coming from, but how do we make it fit together, and where do we need to go forward to make it fit even better? Sheriff, I'll start with you.
I can't tell you, just from my position, how thankful I am for all of the resources that have been made readily available. I think that what I hear most often, and I will remember the most from this presentation, was the slide about the Mallory Center, what percentage of the people are brought there by the different agencies. I think that families are still struggling and holding near and dear to themselves. I could get funding for families to get assessments and get a plan on board would alleviate a lot of the stressors that they are currently absorbing or bearing on their own shoulders. And that's sad, because there's no agency in Carson City that would turn somebody away. But when I say that, it certainly feels like it. In the end, it does come down to dollars. It always does. And in order to provide the services that all four of us up here have been talking about, five, if you will, it costs money. But what is the value of a human life? So we need those ongoing funding sources. I talk to Jessica all the time about this, to ensure that all of our partners stay in that, I call it the sandbox. We all want to continue to stay in that sandbox, but continued funding is absolutely critical.
So, for example, the Jane Doe case, as we move on down, how many dollars were spent just going out, contacting her, saying, move along, Jane, move along, you're going to jail, you're going to the ER, we're going to see the judge, you're going to get an attorney, you're going to go to Lakes Crossing, right, over and over and over again. The efficiency is, I think, something that I think the other three people can work into an answer. I think it's important to address, because it's not just about the cost, it's the synergy of the efficiency of getting the people who are doing the work to do it together in an efficient manner. So, Judge Tatro.
You may recall in fact, they had a display at the courthouse, the $1 million man that the Reno cop, remember the Reno police officer who was a CIT trained officer, put together, followed a person similar to Jane Doe in Reno, and listed every encounter that they had with the police, with the hospitals, with every agency that they had. He tried, and came up with $1 million, and it was verifiable that it cost $1 million. I can't remember not too long a period of time. Yeah, it was 1 year. It was 1 year. So that cost is just unbelievable to wrap your head around. To me, one of the greatest things when we started mental health court, and I'm sure everything else, was when we went to the individual agencies, we had no lack of desire. It's like the sheriff said, everybody wanted to help. It was just asking and getting everybody together, and that's what Jessica and Joe have been so great at doing. And now, I mean, I think it just continues to evolve from that, and it's just going to continue to help. Plus, it continues to find problems, but then you're resolving the problems as opposed to just sending them to jail.
Anything from the behavioral health professional on the end on this?
I mean, it's always hard to track dollars you save, right? So when I started in the jail in 2001, I said, how do we deal with these crises that come in? And they said, we call the fire department, and they respond to the jail. So the cost of the ambulance ride, I think even then was close to $5,000 for every crisis they had. So by just having me situated there in 2001, suddenly we had 0 fire department calls for the most part. Once in a while there's some critical incident. But so it's hard to track those dollars that are not saved. If you want to know another case, I think they call it, is it $1 million Montague?
It's $1 million Murray. That's
Murray.
right.
Oh, that's what it was.
Yeah.
But is it a San Francisco case?
No, it's a Reno case.
case. Okay.
And Malcolm Gladwell wrote about it in the New Yorker article, so you can Google that. It's a good article.
But so imagine what it would cost to house some, like $1 million went to these emergency services and didn't resolve the problem. And I think that's the other end of that formula is $1 million was spent, but we got nothing from it because it's crisis, short-term solution to a long-term chronic problem that was never ultimately addressed.
We're at 5 minutes. I have one person. I'm not supposed to take questions from the crowd, but only one person raised their hand. So we'll go for it.
Why can't we use the tax money from marijuana?
I don't know.
I know.
He knows.
It's because it's going to education. So basically, not only are we 51st in the nation for mental health, but we're also 51st in the nation, or 50th for education. So, it's kind of like, where do you put the money towards? But I did want to throw out the informal resources. Someone talked about churches. I think that is the next step, is really utilizing and building those relationships with churches, with the family, and the peers. We're really not using our community's greatest strengths that are already built in. And so I hope that we can really look at engaging that, especially with the crisis now model. This stuff can actually be more inexpensive the more refined that we get.
But we are kind of in that.
I'll be quick, in that, there's Fish and the Ron Wood Center and other agencies like that churches in this community heavily fund. They help fund Fish, they help fund the Ron Wood Center and give them resources. So
Right.
I
And
think
they
a lot
have
of
the
that
homeless-
is there.
yeah,
And they
yeah.
have the homeless space,
Right.
all that.
But we can do more. That's all I'm
Right.
saying.
I mean, community counseling center has its roots in the church, right? I mean, it's one of those things that, in interfaith kind of cooperation to kind of, to start substance abuse counseling in the very beginning. So, I think this is it. There's a question for me, explain once, so for me to explain what misdemeanor treatment court does. I will stay up here, whoever wants to talk about that, I'll do it individually. This is, I don't want to take away from what we're talking about, which is mental health and criminal justice and law enforcement and all the great work that people are doing. Sheriff, former soon-to-be senior judge, Dr. Joe, Jessica, this was great. I learned a lot. I hope you all did too.